Richard Fuller.
Thank you, Madam Deputy Speaker. I will, like my colleague, the Chair of the Select Committee, I will be supporting the Government on this measure, and in so doing I will be breaking a pledge in the Conservative Party manifesto at the last general election. This is not done lightly, and I do it for two main reasons. Firstly, the £400 billion cost of COVID has created a gap in the country's balance sheet that cannot be ignored. It cannot be wished away. It has to be dealt with, and it is fiscally responsible for the Government to produce the measures today. Secondly, we have, as honourable colleagues have said, deliberated on reform of social care for more than a decade, with every day of delay creating more risks for families. I want reform, and it is right that it is done, and best that it is done by this Government at this time. But there will be consequences from these increases in tax rates. They will hold the economy back. Public services require a thriving economy to fund them. In turn, a thriving economy requires people to be inspired to create, to take risks, to invest capital, to make profits, and to grow their businesses' skills and talent. This is something we as Conservatives understand. It is capitalism and competitive markets that deliver. And if I may say, Madam Deputy Speaker, I would like to hear a little bit more from our Government about how good the power of free markets is, and a little less boasting about the latest ways they're spending taxpayers' money. With taxation rates already at highs for the last 60 years, for members on this bench to describe themselves as low-tax Conservatives means they need to be supporting efforts to reduce public expenditure. Every departmental minister right now, ahead of the budget, should be raising the bar for investment decisions and casting out those projects that fall short. Each minister should be taking an axe, not just to an obvious waste and inefficiency, but to meaningful slices of expenditure that reflect an over-bloated state rather than essential public need. This applies to all departments, including the Department for Health and Social Care. The NHS is a great hallmark of British society, but it is not a religion. It is an organisation of people to achieve a social purpose. As an MP, my role, our roles, are not to deify the National Health Service, but to hold it to account for its effectiveness in achieving that social purpose. Yet it is so dispiriting when taxpayer funding for healthcare is increased, when the immediate response of those in positions of knowledge or responsibility in our health service is to say the funding is not enough. It is dispiriting and it is irresponsible to the taxpayer. It is not acceptable that the leadership of the NHS shies away from even the most modest of productivity targets. It is not right that by the BMA's own calculations of the 134,000 people involved in general practice, more than half, 70,000, are non-clinical administrators, and yet so many of my constituents find it so hard to get an appointment. I wish to see reform of social care, which eliminates the excessive cost risk for families. I recognise that a private insurance market for these risks cannot exist without significant state intervention, and that for a period at least, taxpayer support is required as care services are reformed. As of today, we have promises but not guarantees for reform. I am placing considerable faith that these reforms will be implemented by 2023. The Government and the NHS must deliver.